This is the case study for rheumatic fever. Our patient is Francis, a 10-year-old male. Rheumatic fever is most common in 5 to 15-year-olds. History. Francis had a strep throat 3 weeks ago. However, he did not finish his antibiotics. His temperature is high at 102. His BP is 104/63, which is normal. His respiratory rate, 20, is normal, and his heart rate of 76 is normal. His signs and symptoms include feeling tired, headache, ankle and knees that are swollen and red, painful joints, and a rash that looks like this. To test, we first test for strep throat. We also have a physical examination. We check the joints for inflammation. We check the skin for nodules and rashes. We check for fever. We listen for heart murmurs. And we look for signs of inflammation of central nervous system. And this will be shown with jerky, uncontrollable movements. You can also do a blood test, an EKG, which would, with a prolonged PR, would show inflammation of the heart. And we can also do an echocardiogram. Treatment would be antibiotics for the strep bacteria, as well as preventative treatment for reoccurring rheumatic fever, and anti-inflammatory medication. Causes. The cause is group A streptococcus bacteria, which is strep throat basically. It is important to get an early diagnosis for rheumatic fever because it causes inflammation to heart and blood vessels, which could be very problematic.